Hi, everyone, and welcome to our first Soundbite with the Maine Health Center for Tobacco Independence Training and Education team. This Soundbite interview will last approximately 10 minutes, and we're excited to have you join us for the conversation today. For this quarter's Soundbite, we're going to be chatting with one of our tobacco treatment specialists from the Maine QuitLink about some frequently asked questions ranging from what is a tobacco treatment specialist to how can someone be successful in addressing tobacco use with their patients. We hope you enjoy this interview and let's jump right in. So first, I want to thank our tobacco treatment specialist for being here today. Would you mind sharing 3 things about yourself before we get started?
Sure. I love a cup of coffee in the morning. I've paddled a canoe all over the state of Maine, and I love being dad to 2 young people who are now young adults and watching them thrive.
Great, thank you so much for sharing. So now that we know a little bit more about you, let's jump into our frequently asked questions.
Sounds great.
So our first question is, what is a tobacco treatment specialist?
Tobacco treatment specialist is a professional with the skills, knowledge, and training to provide helpful, evidence-based interventions for tobacco dependence. Tobacco treatment specialists can come from many different backgrounds, such as social work, crisis work, health coaching. They may be graduates of a public health program or come from other healthcare disciplines. They may be folks who are just caring individuals and may have experience working on the phone and other capacities. Tobacco treatment specialists can also work in many different settings, and they can educate other healthcare professionals also about tobacco dependence treatments.
That's interesting that this job is encompassing of so many diverse career paths. I'm sure it brings a lot of different experiences and expertise to the work.
Yeah, well, one of the great things about the Maine QuitLink is that our team does come from so many different backgrounds. And another thing is that people who enroll in our service get from this is that they do get to talk to all of us. We don't single ourselves out and assign ourselves to just one tobacco user. So they get the benefit of all of our experience.
Yeah, that's great. So on to our next question. What are the benefits of becoming a tobacco treatment specialist?
Boy, there are many. And for me, I'd say having been a tobacco treatment specialist full time for over 8 years now, um, that first and foremost, just knowing that I'm helping someone who's struggling to recover from a very difficult addiction is a great benefit.
Yeah, I can imagine that's an extremely rewarding aspect of this job.
It absolutely is. I and all the tobacco treatment specialists I work with do hear regularly from the folks who enroll in our program that they have quit and they may be still on that path to quitting. But we get to hear that we made it possible for them to quit tobacco. They may be breathing better. They're telling us they're sleeping better. They have more energy. There's more money in their pocket. And they'll tell us they love the freedom from the controlling nature of nicotine. So I'd say another benefit is just knowing that it's very clear that this addiction can be treated successfully at a fairly low cost compared to other addictions. And it's reassuring that treating tobacco in this way is so valuable to individuals, to families, and the communities that we serve. And it's a great benefit also to know that we're connecting with people over the phone with very real conversations about their challenges when it comes to quitting. Just knowing that I have the training and knowledge to listen carefully and respond in a helpful and respectful way is also a benefit of becoming a tobacco treatment specialist.
The benefits of this job seem incredibly fulfilling, knowing the impact you're having on people's health and their lives. So what would you want to tell people about the work that you do?
Let's see, I guess I'd want to tell people that because the tobacco treatment specialists at the Maine QuitLink do work with tobacco users on a regular basis, that we become very good listeners. And we also become very good at normalizing those challenges of quitting that people express that make them feel guilty or ashamed of their smoking or tobacco use. So we can use all the tools at our disposal, whether it's educating someone about how nicotine hijacks the brain, explaining how nicotine replacement works, as well as available free nicotine replacement options, whether we're inviting a smoker to share what's working and what isn't, and then brainstorming together some new workable ideas, or offering suggestions that have been proven to work for others who've been feeling stuck. I'd say the people we serve very often feel hopeful about their chances for success at the end of a conversation. And I think in large part, it's because we can take the time to talk about this one thing for 20 minutes or so.
So what do you think that patients are able to take away from these conversations?
I'd say depending on a person's needs, the tobacco user comes away with feeling heard, that someone understood them, and that they have also some very concrete tools they can start using to jump into their quit attempt and to continue using as they move along that path.
I can imagine it's incredibly important for patients to feel heard, and knowing that someone cares for them and is there for them, I'm sure means a lot.
It does, and they do tell us that, especially during the pandemic, where people have felt very isolated and often smoking more due to that isolation. That they say, I'm glad you're here. It makes a difference. Thank you for calling me every week. So it's, or every 2 weeks, whatever the case may be. So yes, absolutely. Patients and our participants tell us that it means a lot to them.
Yeah, that sounds like an incredibly rewarding aspect of the job. So on to our next question. How can someone be more successful in addressing tobacco use with his or her patients?
I think simply asking in a non-judgmental way, what is your patient thinking about in terms of their tobacco use is a good place to start.
Yeah, it sounds so simple, but that really is a great first question and place to begin with your patients.
Yeah, and it might even be helpful to start by saying you're bringing it up because their health is so important to you, um, and letting them know you're not pressuring them to quit and that it's completely their decision and you'll meet them where they're at that time. If they do say they're thinking about quitting, then just ask them to tell you a bit more about what their thoughts are.
Right, right. So would you be able to give an example maybe of how you would bring this topic up with a patient?
Yeah, after that initial interaction and they've indicated they're thinking about it, I would just listen for that first most immediate need or concern that they have and addressing that, and just maybe offering a supportive reflection like, it's great to hear you're considering quitting. Based on what you've said, what do you think your next step would be and how can I help you get there? And if they don't know what they're due next and they're not sure, ask if you can make some suggestions based on your experience with other patients who have been in the same place. And if your patient is clear they're not interested in quitting, take their lead and move on, but let them know you're going to be asking them again at another visit as their health is important to you.
Yeah, that's a terrific way to let the patient know that you care for them and are willing to work with them on their level. So our last question for today that I know is a pretty big misconception. So the question is, do individuals with substance use disorder or mental illness want to quit using tobacco?
Most definitely, yes. There's a fair amount of research that supports the fact that people with substance abuse disorders and mental illnesses do want to quit just as much as smokers without these conditions. It's been shown that people with mental health disorders make more quit attempts than smokers without mental health conditions, but they have less success. It's a myth that the symptoms of serious mental illness will get worse when people with these conditions quit smoking. It's actually just the opposite. Psychiatric medications definitely are affected by tobacco smoke. So we always advise people to make sure they're working with the prescriber of their psychiatric medications as they're working on quitting smoking or their tobacco use. Could be vaping and could be chew tobacco or smokeless tobacco. one of the screening questions we ask when enrolling someone is whether or not they have a mental health condition. And it's very common that people we enroll do share they have such a challenge, and that the challenges of their mental health condition do interfere with their ability to quit. They're very clear about that. And because the research shows this to be true, we offer extended support to this group of tobacco users, as well as support for multiple quit attempts.
Yeah, I think it's so important for folks to know that people with substance use disorder and mental illnesses do in fact want to quit, and they actually attempt to quit more often. I think that's a fact that a lot of people don't know. So having that extended support for these populations, I'm sure, has been beneficial in so many ways in assisting them to quit.
Absolutely, and I get to hear it on the phone from them every day. One gentleman recently said that he marks on his calendar the day we're planning to call next, and just knowing that we're going to be calling is like a reward for him that he really looks forward to every week or two. So that was so great to hear.
Yeah, I love that. That's a terrific story to end with. So I wanted to thank everyone for tuning in today and listening to our first soundbite featuring a tobacco treatment specialist. I wanted to extend a huge thank you to our tobacco treatment specialist for participating and answering our frequently asked questions. We hope you enjoyed our conversation today, and if so, make sure to visit our website at www.ctimaine.org for the recording and to stay up to date on future episodes. Thank you, everyone.